And Katie, you can, your floor is yours.
Thanks, Conte, and welcome everybody. We have a number of just different things to touch base on today. So this is a bit more of a hodgepodge kind of set of issues because we wanted to make sure that we had a few discussions that were timely at the moment, but also some other issues that we wanted to just sort of bring forward as a starting point. So we do have, so welcome to the call. So thanks, Conte, for popping that up. We're going to be going through sort of World TB resources from GFAN, as well as other spaces like Global Fund, Stop TB, where you can get resources for World TB Day, which is tomorrow. And we're going to be, we're joined by Rachel from GFAN Asia Pacific to give us a debrief on the Global Week of Action that many of you participated in or saw taking place 2 weeks ago now. We have Chris Collins joining us from Friends in the US to give us a bit of an update around the US president's budget, which is expected next week, and so what that might look like, what to watch out for. And then we also have a discussion on One Health, which if you're like me 6 months ago, maybe you didn't know what One Health was and had to learn a little bit. So we wanted to bring that issue and have some colleagues join us from organizations who focus on have focused on One Health for some time and wanted to just bring that here to a GFAN meeting and explore sort of what, further conversations or further information might be useful to you as GFANers. As this continues to be a focus for the Global Fund and other multilateral and global health sort of actors. So that's kind of the big agenda today. And so I hope that that's clear. We hope that at the end of the call, there's an opportunity for colleagues, if you have any announcements or quick pieces of work that you'd like to share. We hope to have a few minutes for that as well. So don't hesitate to put your hand up at that time. But Conte, I'll just pass it over to you around the GFAN World TB Day resources and toolkit. So.
Thank you, Katie, and hi everyone. Good morning, good afternoon, good evening. So some of you might have seen an email I sent earlier today, and I'm going to put all the links from that email back into the chat. So it's a grand tour of all of our resources and resources from friends around World TB Day. So first to cover what is it that we have included into a package, some of the pieces we have produced. So we just released a blog, which is an overview of the state of the fight against TB and the road to meeting of 2030 target. The blog is on the website. There's a link in the chat, and we try to cover some of the latest developments. We talk a bit about the situation in Ukraine and the impact that will have on on the trajectory of TB in Ukraine and in the neighboring countries, and just generally give a sense of why is it particularly important now at the time of replenishment to really focus our advocacy around global fund replenishment, the global fund being the largest donor on TB, largest international donor on TB. And so you can find all of that in the blog. So we are also included, and this is included in the email, I can't put it here in the chat, a number of visuals and social media guidelines so that we share on this for in terms of messaging, and so to go alongside any content you would like to share. We try to you have smaller versions of that content on the screen now, with featuring two of our GFAN speakers, Olia and Annie. And so we chose to feature their stories because we recently produced interview videos with them that you might have seen. We'll be resharing them today and again tomorrow. It's fairly short, they're under 2 minutes, and they tell their own stories and how they faced, survived, and rebuilt after TB with the help of the Global Fund. And finally, this is a plug for a bit of an older piece that you might have, I hope you've already all read, printed, pinned above your beds. But in case you haven't, we've released recently a number of issue briefs, and among those, there's two that I think really relevant on World TB Day. So the first one, of course, is on TB, which we called Ending TB in a COVID World. The relevance to World TB Day doesn't need to be further digged into. It's got a lot of very almost up-to-date statistics. As we know, the problem in TB is that those statistics are not particularly up-to-date. It can take a year or two to actually get to know what has happened. One of the things we highlight in the brief is how we will see the consequences of the current wave of increased missing cases into 2022, into 2021, 2022, which are, we're already there. We just don't yet know because they're taking so long to be released. Anyway. And we also have a domestic resource mobilization brief, and that's also very important with regard to TB, because of the three diseases, TB is most reliant on domestic resource. More than 80% of the money spent on TB globally is spent domestically, and there is we have seen a squeeze in the amounts that are dedicated to TB from domestic resources, and it's extremely worrying. And that it makes it all the more important to see international donors and international aid retake center stage during the after COVID in the TB fight. And I also included links for partner resources. So the Global Fund has published a press release on its website earlier today. Earlier today for me, I don't really know what day it is. It's got, it's very aligned with the messaging that I promoted during the IC. It's got a few up-to-date statistics and updates, in particular on the situation in Ukraine. The press release is quite interesting. They also released this week a social media toolkit that is also quite good, pulls from the results report, the investment case, and some of the similar material to the press release, which is also useful. But we also wanted to mention the Stop TB toolkit that was presented during our last GFAN call, and is extremely comprehensive around, as a lot of elements for social media, a lot of advice and messaging, hashtags, etc. But also guides on how to print your own t-shirts, make your own buttons. Like there's a lot. So if you still are not sure on what you want to push for on World TB Day, have a look at the Stop TB toolkit. It's very broad. And with this, I will end my presentation, so we have time to hear from all our wonderful colleagues.
Yeah, and I'd just say Ani has been able to join us on the call today. So Ani, if you did have anything that you wanted to say, but in terms of World TB Day, please be welcome to unmute and say it. But otherwise, yes, are there any questions or comments about what Conte has just presented on? Okay, I think it's pretty clear. There's a lot of resources for folks to use, and I think that TB colleagues would greatly appreciate us using our collective sort of strength in virtual spaces or in other meetings that we might have over the next couple of days as we reflect on World TB Day to take up some of these resources and make a bit of a splash if you're able to. So please, don't hesitate to be in touch if you do have any questions. So we'll just move on to the Global Week of Action and get a debrief from our colleague Rachel. So yeah, I don't think I need to introduce it. We've talked about it on a number of different GFAN calls over the last month, and many of you participated in it. And Rachel, I'll pass it over to you for a bit of a debrief.
Thanks. I am facing the colorful wheel of death on my desktop. I wanted to show the slides I had put together. Sorry, I'm a little bit lost at this point. Would you give me come back to me maybe in 10 minutes?
Sure. Yeah, no problem. I think
thank you.
That's no problem. And if you want to and you're able to, Rachel, just flip it by email to us, and then if we need, we could present it for you if that's helpful. If you have slides.
Sure.
if you're able to see something beyond the colorful screen of death or whatever you called it. So
Oh,
I will,
it's not working. Actually, it's not again. I'm sorry. I think I'll need to come back in 10 minutes. I'm really sorry.
no worries. No worries. So I'm just going to tap Chris Collins, who has joined the call, and hopefully, even though we're going to call on him about 10 minutes early, hopefully that's okay, like it is. So Chris, from Friends in the US, Friends of the Global Fight in the US, you've been letting some of us know that there's an important moment coming up next week. So we thought it would be useful to take a second here on the GFAN call for you to share with us what that moment is, what it means, and what we can look out for, and what we may want to do to support you and your colleagues. So go ahead, Chris. Thanks for joining us.
Wonderful. Good evening, good afternoon, good morning. Hi, Katie. Thank you. Yeah, I just wanted to make sure everyone's aware that we do expect the president's budget proposal for fiscal year 2023 for the United States to be coming out Monday. And there will be a line, and it's going to be a full detailed budget. We thought for a while it would be a shorter version, but this will be a detailed budget, which means it for sure will have the Global Fund request number for the United States this year. Now we've been calling, and a lot of organizations have been calling on the administration to provide at least $2 billion in their request for the Global Fund. That would be consistent over 3 years with a $6 billion US contribution, which of course is consistent with the US providing a third of resources towards the target of $18 billion. We've been clear with the administration that they really have to come in at $2 billion on Monday if they want to be showing that they're consistent with getting to an $18 billion replenishment. So they're aware of that. You know, I think there's plenty of room for hope that they will meet that number. We don't know what they're going to do. It could be lower than that. In any event, I think it's likely enough that we get a number that we really like, that we begin thinking about how to use this and catapult advocacy globally from the US budget request. You know, important to say that the president's proposal in his budget that comes out Monday doesn't make the contribution final for the United States. It then needs to go to Capitol Hill. The House appropriators will consider their number. The Senate appropriators will consider their number. But I think if the president comes in at $2 billion, I think we've got a very good chance on Capitol Hill of securing that money from the US. But, you know, I think if they do put the $2 billion in, it's also a huge advocacy tool for all of us with other donors to say, look, the US really stepped up. It is not only hosting, but the president has requested money consistent with the $18 billion goal, a 29% increase. It's now time for other donors to meet the US in that step up and themselves commit that level of increase in their pledge. So I think there's a lot of ways that folks can work with that. At Friends US, we'd love to help and provide any materials that would help you get the word out. We'll certainly have a media release out on Monday, whatever happens, and we'll get that out widely. But I do just think the budget request from the president could well be potentially for us a real catalyzing moment, because it really could say, look, the biggest donor is sending the right message. Everybody else now needs to take that leadership and step up.
Thanks. I think that's really helpful. And Chris, could you tell us a little bit about the day of? I assume it kind of happens a little bit later in the day, Eastern time, and sort of when Friends would be sort of reacting or giving us as colleagues an opportunity to know what your thoughts are, especially if the number is less or even more, but more is always better. But especially if the number were less, just to give us a quick sort of sense of that timing wise, because I think we do generally. And the US one is one that gets a lot more attention always, no matter what, but will this time because of the role that you've just mentioned. But we do generally try to encourage colleagues to make sure that we wait and we hear from country colleagues in the country making a pledge or making a contribution sort of signal like this one is, to wait until we've heard from all of you before going on a big splash on social media or anything like that. So if you could just give us a sense of that in terms of timing and what we could expect to hear from you and other colleagues in the US, then I think that's just helpful for everyone to be primed for next week.
Yeah, the budget often comes out at 10 a.m. Eastern time, but it doesn't always. But I'm going to assume it's going to come out between 10 a.m. Eastern and noon Eastern. We can, Katie, let's make a plan, but, I can let you know the minute we know. I can, send you a WhatsApp or whatever. We're preparing, 2 different media releases based on what could happen. And I would really like to get a media release out as soon as we possibly can, morning US if we can. If it comes in at 2 billion, then I think we'll be able to get a media release out that morning. The other factor for us to think about, just in terms of when we get a message out from friends, and also what the message is they could do really well on the global fund, but what if they cut another global health program like PEPFAR, which is in the same funding bill, of course? So what if they play a zero-sum game and cut other aspects of global health? We're going to have to name that, and we're going to have to, call that out and oppose it. So that, it's going to take a little bit longer to see where PEPFAR and President's Malaria Initiative and the other aspects of and TB at USAID, we're going to have to really see where those are before we react. And that may take a little bit longer, but I think we'll know the global fund number probably right after 10.
No, I think that's really useful, and I think that's really useful context to understand, the broader implications of what will be, in that, or what could be in that president's budget next week, so that we, we understand the broader context, as you said, in terms of other allocations or requests, I guess. Such a complicated way that you guys do your budgets in the US, but you do always make it simple. So does anybody have any questions for Chris? Just looking to see if anybody's unmuting or raising their hand. And I'm not seeing that. So Chris, thank you very much for that context. I think it's just really helpful to know that that's coming out. And I think we'll probably be back to you to get a more in-depth kind of, so there was a question, Ross. I think the president's budget is expected on Monday, the request of next week. So I think that's the 28th. Yeah.
Yeah. Monday.
Yeah. So, and Chris, will probably call on you to come back on the next GFAN call in 2 weeks to give us a better debrief when we do know the full context of that president's budget request. So thank you. Yeah.
Great. Thanks.
Okay. Thanks, Chris. And I'm actually going to pass it back to Rachel, who is hopeful that she has her presentation working. It was 5 minutes ago. So Rachel, over to you to go back to the debrief from the GFAN Week of Action. Just give Rachel a second here, fighting with her technology, very late in her day. And I can't hear you, Rachel, if you're able to unmute. But now I think we've lost her. Oh, this is not good.
This is not good.
This is not good for this time of day as well for her. So late. Okay, so I think just sorry everyone, just give me 1 second just to check and see if I don't have a message from her on another platform. So I think that we will just try to move forward in terms of our agenda, and if we're able to, we'll get Rachel in. Oh, there's Rachel back in the call. Are you there? We go. Screen is sharing. Can we hear you? Still can't hear you, Rachel. Sorry, everyone. Just give us a second. I'm gonna ask Rachel to unmute and see if that helps us. And otherwise, I think we'll have to move on for now. Okay. Okay, everyone. So Rachel, I'm really sorry, but this doesn't seem to be working. So we will try to come back to you a bit later. Tara and Conte, I'm actually going to pass it over to you, Conte, to lead us into the next discussion.
Okay, I'm back. Sorry.
Just as I start to move us forward and give up, you show up. So there you go.
So I don't know. There's something wrong with my computer. I probably need to restart it at some point, and then sorry, I wouldn't bore you guys with the details. Let's move very speedily along. You have seen this slide many times. Just as a quick update in terms of the actions, we have actions. The numbers don't reflect the donor country colleagues who joined us also on social media. These are specifically the in-country actions. We're still waiting for colleagues to come back. We've only had slightly over 30 responses from people. So we're still waiting for more than 20 countries to come back with information. In terms of where we are looking at 18 countries that have joined us in social media. We're still collecting the information. Some of them, because we haven't had a reply on email, so we had to trawl different sources of social media for that. A total of 257 letters have been sent, 169 on email, and then there were letters that were hand-delivered, couriered, or posted that are about 91. There were 19 meetings held virtually and physically. We're still tabulating the numbers because we're cross-referencing and making sure that information from our colleagues is accurate. And that countries that had received, so donor countries that had received the letters or had meetings with civil society colleagues is at 40. So for those that haven't had a chance to see some of the really lovely pictures that were posted on social media, here are a few. We had colleagues from GFAN Africa with the origami animals. Sri Lanka had a virtual meeting with our Indian colleagues because the embassy was looking after both countries. They're also having a meeting with US coming up as well. So just to let everybody know that meetings are still being arranged and they will be carried out over the next few months, next few weeks as well. We had lovely t-shirts created in Rwanda. And just to let you know, our African colleagues were really creative. Some of them actually have slightly different variations of the t-shirts. Indonesia took this also to the C20 kickoff meeting that was held in Bali. We had also our colleagues in Burkina Faso, arranging and folding the cranes. We had colleagues in Thailand engaging their children also to participate in folding the cranes, for example. Ugandan colleagues getting ready to in preparation. Nepal as well with the Norway embassy as well as the EC. So just a few highlights for now, and we're still going to tabulate and finalize the information over the next 2 weeks. Over, Katie.
Thanks, Rachel. I think that's really helpful. And it's so nice to see all those pictures. It was so great to see so much that was happening and people were sharing pictures through. I had a WhatsApp. I was getting photobombed, regularly for a few days on some of the WhatsApp groups with colleagues in Africa and Asia Pacific. But it was really wonderful to see, sort of all the work that was taking place. Yeah, so this is really great. I'm just looking to see if anybody has any questions, but just to say, this week of action was meant to be sort of a kickoff and, that kind of thing. But hopefully some of these themes like the cranes and the origami and some of the messaging that was created for this campaign by Rachel and her team in collaboration with GFAN Africa and ourselves, hopefully this can be used at other moments in time over the next sort of few months, and happy to have those conversations with any of you that feel that elements of this would be useful. Although I think Rachel would probably unmute herself and be angry if I was suggesting in any way that Rachel would do another one of these weeks of action, anytime soon, because it is a huge lift. So any questions or comments from colleagues on the call for Rachel or others around the week of action? It was it was great. It was great to see all of the work and all of the excitement and passion that advocates brought to the week. Any questions? Chris, I see you've unmuted yourself. And now raised your hand, so please go ahead.
No, I put it in the chat box, but I just wanted to say thank you so much for part of this campaign that Rachel and others integrated at the last minute was retweeting this great tweet that came from Lois Pace with the Department of Health and Human Services, where she's a senior official with the US, and she endorsed in a tweet the $18 billion target, which is a very good sign. So anyway, Rachel and others masterminded a Twitter retweet storm on that, and it was just great. And we've shown that off now to the budget people and to the national security people in the administration to reinforce the global support. So thank you.
Great, thank you. Any other questions or comments? Do just unmute yourself if there is something you'd like to say and you're struggling to find the raise hand function. Okay, not seeing anybody. Thank you, Rachel, so much. And good luck with your computer. Conte, I am going to pass it over to you to lead us into the introductions for the next sort of section of our conversation. So Conte, over to you.
Thank you so much, Katie. One topic we've heard quite a bit about over this replenishment campaign, and especially since September, has been One Health. It's part of a global fund strategy. We've had requests for speakers to be sent to talk about One Health and the global fund, and it's been, as Katie said, challenging for us because it's not a space we used to. It's not a space where we feel like we have the expertise necessary to engage, and there are not spaces where we know many people. It's been a fairly separate space especially from the HIV world, out of which a lot of us come, and so we thought it would be important as COVID-19 is COVID being a zoonotic disease coming from animals. It's really it really shone an even brighter light on One Health and these types of issues, and we thought it would be important for us as civil society to be able to better understand what One Health was, what were the issue, what was at stake, and how to engage. And I think there is a perception that it tends to be a fairly expert-driven area and field, and I think it's partly true, but I think it's also true because we've not yet invested that space, and the first step towards that is for us to train ourselves. And so for that reason, we wanted to dedicate a fairly big chunk of this call to open discussion on the topic. And to do this, we've brought Ellie Parravani from the Brooke Institute, who can bring in that expertise that we don't always feel like we have when it comes to One Health topic. And so, Ellie, I'll give you the floor for your presentation, and then we'll follow that up with a Q&A.
Great. Hi, everybody. Thanks so much for having me. I hope you can hear me okay. And I'm just going to share my screen. Can you see that? Yes, excellent. Great. Thank you so much. And thank you for having me. Just still catching my breath, running from one meeting to another, but hopefully we'll be okay. So yes, it's really nice to see you all. And I just wanted to say that, you're already doing One Health because you've invited me to this meeting. So you're already one step towards it. So I'll just give you a really brief, very simple overview of what the concept means, and a couple of examples of One Health in action. So just to explain, I work for an organisation called Brooke. So Brooke is an international animal welfare organisation, and we concentrate on working animals, so working horses and donkeys. And these animals, they provide transport, haulage, production, they help with farming, coffee production, all sorts of things. They provide a vital income for some of the world's kind of remotest and most marginalized communities. But I work specifically on a project that Brooke set up called the Action for Animal Health Coalition. So we are about trying to strengthen the animal health aspect of One Health. And that means essentially that we want to see better investment in those animal health systems, kind of similarly to a human health system, around disease surveillance, increasing the workforce, having a better quality of workforce, and making sure that those animal health professionals have access to veterinary medicines and vaccines that they need. Because at the moment, there's a huge shortage of these professionals, and that's having all sorts of impacts. So just to say as well that the concept of One Health, it's been around for a long time. It's not a new idea at all. But now it's gaining a lot more kind of political traction because of COVID-19. The fact that COVID-19 is a zoonotic disease, so it's a disease that passes from animals to humans. That relationship is getting much more recognition now. And just to give you an idea that before COVID, it's estimated that zoonotic diseases caused 2.5 billion cases of human illness and 2.7 million deaths a year. And that's before COVID. And 60% of current diseases are emerging from animals, and 75% of new diseases are emerging from animals too. So this is a real big issue for human health and emergence of pandemics as well going forward. I also just wanted to make this point that it's not the fault of animals. This is unsustainable human activity that's caused this, and the sort of exploitation of nature means that these diseases are emerging more frequently from animals and jumping into human populations. So that's wildlife, but also domestic animals such as wildlife can be sources of disease and amplify those diseases that are emerging from the wild. And also, poor livestock care, unsustainable farming practices are also a major contributor to this, and also to AMR as well, which I'm sure you're all well versed in. So just to give you a definition of One Health, this is a very new definition of One Health. There's a new expert panel that's been set up in the past year or so called the One Health High Level Expert Panel, who were commissioned by the Tripartite, which is the World Health Organization, the OIE, which is the World Organization for Animal Health, and the FAO. So they commissioned this group to come up with this definition. So I'll just read it to you. It's a bit of a mouthful, but it's really quite a simple concept. So One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognises that the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. So the approach aims to mobilise multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems, while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. So basically, in a nutshell, it's the idea that the health of ecosystems, animals, and people are all very, very closely interlinked. And that means different sectors need to come together to make sure that the health of those three areas are optimal. So just to show you that in a diagram in a slightly more simple format. So you've got those sectors and disciplines, animals, humans, environment coming together, and then that whole of society approach. So rural, urban, mobile communities, local, national levels, regional and global levels, all coming together to coordinate, communicate with each other, and collaborate to optimize health in those three areas. So, there's no blueprint for how we do this. You can kind of take this concept and make it mean whatever you want it to mean. I'm sure, many of us are probably already doing One Health. We're just not necessarily calling it that. So hopefully that visualization helps you to kind of understand what this concept means. So I'll just go through a couple of case studies to show One Health in action. So the first example is around rabies. So rabies is kind of seen as the classic example of One Health in action. So just to give you a bit of background, it's a neglected tropical disease. It kills 59,000 people every year. But the fact is that it's entirely preventable. It's very much a disease of poverty. It affects low-income regions and disproportionately affects children as well. But it's the solution to preventing rabies lies in the animal population. So 99% of rabies cases come from a dog bite. And once you've been bitten by a dog, you can get post-exposure prophylaxis, but the fact is that it's really expensive and not particularly accessible to the people that are most likely to be bitten by a dog. So if you're bitten by a dog in a rural area, you've still got to make your way to the capital city somehow in a certain amount of time to get that PEP vaccination. And once symptoms start to show, then it's fatal, and it's a very, very nasty way to die. And also in terms of the dog welfare side of it, if there is an outbreak of rabies in a population, sometimes communities or even the government might respond by poisoning all the free roaming dogs or beating them to death or finding another way to cull the population. So it has massive welfare implications for both people and dogs too. But the point is that the cheapest and most effective way to eliminate this disease is to vaccinate the dog population. So vaccinating a dog costs about $8 compared to over $100 to get that PEP vaccination. So you really need the human health sector and the animal health sector coming together to solve this problem. And then also you really need community level buy-in as well, because people need to bring their dogs to clinics to be vaccinated. And they also need to know how to get that appropriate medical care if they have been bitten by a dog, and also how to avoid dog bites in the first place. So how to interact with dogs in a way that means you are less likely to be bitten by one in the first place. So really, like I said, it involves cross-sector collaboration to vaccinate the dogs, raise awareness, and also to make those PEP vaccinations affordable and accessible too. So that's a really sort of classic example of One Health. Another one is from one of our coalition members. So our one of our members worked on a mixed mobile health clinic in northern Mali. So northern Mali is an extremely dispersed, it has an extremely dispersed population. So there's one person every 2 square kilometers. So people are really spread out. The majority of people rely on animals for their income, and they're often pastoralists who move around to find food for their animals. And kind of previous animal and health human services had failed in these environments because they were often static clinics in one place. They weren't adapted to pastoralist nomadic way of life. And to get to one of those static clinics, it could take somebody a whole day's earnings to get to one. And that meant that people would often rely on, on quacks who weren't really qualified to treat people or to treat animals either. So an organisation called Agronomes et Vétérinaires Sans Frontières and the Association for Endogenous Development, they set up a mobile health clinic that serves both people and animals at the same time. And they have a huge emphasis on treating zoonotic disease because it's obviously a major challenge in communities where people and animals live really closely together. And the kind of beauty of this approach means that those two sectors, they can pool resources. It's kind of cheaper in the long run to work together in this way. They can share interpreters, they can share the cost of fuel, and they can share the cold chain management for the medicines and vaccines they need for both humans and animals too. And when the mobile clinic, in between the rounds that the mobile clinic does, community members are trained. So often farmers and traditional midwives are trained to monitor sick people and animals in between those visits of the mobile clinic. And there's also an environmental aspect to this as well, because the decrease in rainfall and increase in climatic shocks means that people are moving around even more with their livestock than they do now. And so having that mobile clinic, that works in harmony with these nomadic ways of life, it's really essential to securing the health and well-being of people. So, that's a good example of people really working together to optimize the health of both people and animals, and also responding to those environmental changes too. So, just to kind of finally, some of the key structures and resources that will be useful to you if you want to learn more about One Health. There's the One Health high-level expert panel, which I mentioned. So this is a group of about maybe 30 experts who worked on that definition of One Health. And they're also working on a global action plan at the moment, which was supposed to be released last week, but didn't seem to be. So hopefully in the next couple of weeks, it will be released at some point. And that action plan will kind of outline how that group and how the tripartite, who I'll mention in a minute, want to implement One Health to combat zoonotic disease, AMR, food safety, and neglected tropical disease too. I think they're the kind of key areas that they'll be looking at. And then at the sort of highest levels of governance, there's the tripartite, which is now, as of 2 days ago, known as the quadripartite, which is much more difficult to say, which is made up of the WHO, the OAE, FAO, and now also the UN Environmental Programme too. So there's been a recognition, and Quentin and I talked about this as well, that the environmental part of One Health hasn't had quite as much attention as it should have done. So that's where UNEP have been brought into the fold of this group. There's also the Berlin Principles on One Health, which you might find quite interesting. So these were made by the World Conservation Society, and these very much focus on the environmental side of One Health. And I just pulled out one quote here, which I kind of think sums up those principles quite well. So the current and future quality of human and animal health and well-being depend on humanity's respectful, humble, and responsible environmental stewardship. So essentially what they're saying is that many of the issues we see related to human health and animal health are rooted in the way that we treat the environment. There's also a One Health course on the Future Learn website, which I think is globally accessible. I don't think it's running right now, but maybe in the future, that's something you may want to look at. And also something obviously quite relevant to this group is the tripartite, or now quadripartite, zoonotic TB roadmap. And then finally, if you're interested to see how governments are working on One Health, there's a website called the One Health Commission, and they have collated all of the One Health strategic plans across the world, essentially, or all the ones that exist. So if you want to see how governments are putting this into policy, you can have a look there as well. So I didn't want to talk for too long, so that was a very whistle-stop tour of One Health, and I hope that it gives you a little bit of an overview and also helps you to realise that at the moment it might seem like this kind of expert-led, far-away thing, but actually the concept itself is really simple. And for me, it's really just thinking about who your main stakeholders are, how you can branch outside of the usual suspects, if you like, and who else can help you to achieve the goal that you want to achieve. So I'll stop sharing my screen. Over to you.
Thanks a lot, Ellie. Because of the date, actually, because of the fact that World TB Day is happening tomorrow, I was wondering if you could give a group a bit of an overview of how One Health is particularly relevant in the case of TB.
Yeah, absolutely. So obviously, I'm sure you all know there's a zoonotic form of TB that comes from cows. And as far as I understand, I have to say that I'm really not a huge expert on this. But as far as I understand, it's mostly transmitted through meat and milk, and not often through airborne transmission. And also with TB, the important thing from an animal health point of view is that there isn't really an effective vaccine for it at the moment. So I think there is one available, but the effect is quite minimal as far as I understand. So the main approach to TB in cattle populations is to detect the disease and then to cull to cull all of the animals that have TB. So if it's not spotted quickly, then it can sort of quickly go through the whole population, and it means that lots of animals end up being culled. So, as far as I understand as well, the sort of true burden of TB in cows isn't known that well, and that's because the the surveillance mechanism is quite weak. Farmers don't often want to report it as well, because, you know, if you imagine you're a farmer, you have a cow with TB, if you report it, you then know that someone's going to come along and kill all your animals, basically. And if there's no incentive for you to do that, if there's no incentive or no kind of compensation for you, then, you know, you're much less likely to report it. So I think that that's a kind of a key area to think about, you know, when you're thinking about working on TB, is why aren't people reporting it quickly? Why isn't it being picked up in animal populations, and what impact is that having on human populations? You know, I think as well, from a One Health point of view for you guys, it's about thinking about the people that are most at risk. So the farmers, people that work with animals, and understanding why people are drinking sort of unpasteurized milk, and what we can do differently in that regard. And I just also wanted to make the point that from an animal health point of view, you know, we talk a lot about disease surveillance and the need to pick these diseases up quickly, but part of the issue is that there's a real shortage in animal health workers and vets, and if you haven't got the staff and the workforce available to spot these diseases quickly, then they are going to spread fast. And just to give you a quick stat, so in Ghana, for example, there's just 63 veterinary professionals in the whole country, when they estimate they need at least 600 to 700 to cover the whole animal population. So really those weaknesses in the animal health system do have an impact on human health. So so I think it's really about considering who interacts with animals, how they are kind of treating the animals themselves, if they're able to spot the signs of that disease, and how they can report it quickly as well.
Yeah, and I'm going to just jump in, Ellie. Thank you. It's really great to get this sort of quick overview. And I think for a lot of us on the call, like we started to see, as you said, because of COVID-19, there's been a lot more increased interest in this concept that isn't terribly new, but has gotten a lot of increased sort of attention and some movement, at least, which is probably useful for those of you who've been working in the field for a long time. But so we started to see this come up in the strategy development process for the Global Fund, which just recently, issued, like late last year, issued its new strategy for the upcoming years. And a lot of the but a lot of looking through the strategy for the Global Fund links the climate and environmental sort of impacts, and sort of between the diseases and then the One Health approach. And so I just wondered, you sort of said something in your presentation about the environmental kind of impacts not actually being as well developed as maybe the other parts, the human and the animal. I wondered if you could speak a little bit more about that, because to me that's really interesting, given that seems to be not the only focus of what's been put into the new strategy, but that had been, it seemed like, one of the driving sort of considerations for the Global Fund to engage, at least in terms of how they, set it out and framed it in the strategy document. And as we develop the KPIs and the impact sort of the Global Fund strategy, it'd be really useful to understand a bit better, that environmental impact and what might be some of the next key moments, I guess, around some of that. And you were mentioning the action plan that you'd expected last week but haven't seen yet. So just wondered if you could just say a bit more about why that part of it hasn't gotten as much attention and where that might be going. And then just to say to colleagues, please don't hesitate to raise your hand or put any questions that you have in the chat, and we'll come back to your questions. But Ellie, if you could start off with that, any reflections that you have, that's helpful. And then others, if you have any questions, raise your hand or let us know in the chat.
Yeah, absolutely. I mean, for me, from a personal point of view, I think that the reason that the environmental part hasn't had quite so much focus is probably because One Health has been so closely associated with zoonotic disease, when actually the concept can be expanded well beyond that. And I think that maybe that's why it has been missing, is because only people working on zoonotic disease, which are traditionally the human health sector and the animal health sector, have really sort of embraced this concept. So I think that it's a massive step forward that the Global Fund has taken this approach and has put much more emphasis on the environmental side, because hopefully, you know, if these big stakeholders do start recognizing that, it will get much more attention, and hopefully there will be more research and more action into that side of it. And also, now that UNEP has been added into the fold of the tripartite, I think that again it will get much more attention, and I think it is really just, hopefully it will get more attention if people are just thinking more outside of the box and who they can work with, and doing those kind of root cause analysis. And really looking at the root causes of why diseases are emerging or why particular issues are happening, and we'll see that that environmental side is well rooted in there, and that's something that we really need to tackle. So I think this is a key turning point for the environmental side, and hopefully we'll see much more narrative around that going forward. And I think as well, it's an easy way, and I saw this in the strategy as well, a kind of easy way for you to integrate that into your work is to think about the environmental impact that your own work is having. Even doing that is taking a One Health approach, because you are thinking about how you can optimize the health of the environment as part of your everyday operations. So I hope that's useful.
Yeah, no, thanks. I mean, it's just helpful because, again, if other people on this call are like me, I'd never heard about One Health until it sort of started to gain sort of traction, I guess, over the last couple of years, and really started to play a part in some of the constituencies and some of the stakeholders within the Global Fund Partnership were in particular interested to see this advanced within the conversation. And sometimes you wonder what the politics behind that are, especially when you see strong donor delegations, for example, pushing these concepts. So you just want to understand it a bit better. And so for us, I think this is just a really helpful introduction, and something that may not be the focus of our work or our advocacy in the coming months as we seek to replenish the Global Fund, which takes up a lot of our time and our attention. But as we think, over the next couple of years in terms of that, how we solidify the partnership and the intent of the strategy, I think it's still really helpful to keep this in mind and to keep having conversations like this so that we understand it better as advocates and as, part of the policy processes within the Global Fund when we get those opportunities. I'm not seeing any other hands raised or any questions in the chat. So I just wanted to see if you were trying to find how to raise your hand but couldn't and wanted to unmute, please go ahead, and we'll just see if there is anything else.
I can also just make one more point as well. Like you were saying, it might not necessarily be a focus of your work, but I think that One Health can be seen as both an approach and a goal in itself. So it might be that your goal might not be to optimize the health of humans, animals, and the environment, but actually part of your approach to your own kind of public health goals, One Health might feature more in the approach of how you reach those goals and those things that you want to change, rather than being the goal in itself.
No, that's great. Thank you, Ellie. Really appreciate you taking the time and, expecting that we will have under other opportunities for engagement in the future. And I'm just seeing one. Yeah, there was, as Alex is saying, there was a detailed contribution from French stakeholders about how to integrate a One Health approach. And I know there was from the German delegation, I think, as well. So there were a few really strong inputs there. So thank you, Ellie. We are very close to the end of our time, and I promise that if anybody had any quick announcements or anything that they wanted to raise in general, please go ahead and raise your hand. But thanks, Ellie. We really appreciate you taking the time and being with us. So, yeah. Any other announcements or other business that anybody wanted to raise at this stage? And Conte, you may have some other announcements that I've forgotten about from our side. Is there anything? And thank you, Alex, and all of your notes about trying to retrieve the information around the French stakeholders as well as the event that took place last year. So that would be great, Alex, if you could share that.
And no, there's no, but everything, I've put everything up front, so there's no further announcement coming from our end.
Okay, if there's no other announcements and no other business to get to, we'll let you get back to your day. We've saved you 2 entire minutes, so enjoy those before you get on to your next Zoom call, everyone. But thanks for joining us, and we'll be talking again in 2 weeks or sooner. So take care, everyone. Have a good rest of your day, and thanks for joining us today.
Thank you very much.
Thanks, Ellie.
Bye, everyone. Thanks.